the month of May, Stroke Awareness Month. And this morning, we continue our coverage on the topic with our health reporter, Haley Hernandez. Good morning.
Hey, good morning, Owen. So I'm here with Dr. Anjail Sharrief, the director of the Stroke Transitions Education and Prevention Program, aka STEP at UT Health Houston. Now, can you tell us, what is the STEP program? What do you guys have going on there?
Sure. So the STEP program is a program that I founded when I came on as faculty at UT Health in 2014. It's a program that helps patients who've had a stroke or transient ischemic attack reintegrate into the community after stroke. So it helps to address their risk factors, it helps them on the journey to recovery, and it helps them to get back to their community life.
So it's the what happens after a stroke.
Right.
You know, that's so important with just about anything I do medically, you know, cancer, diabetes, almost every medical condition, the patients fall off afterwards when they're, you know, go back into the real world and be normal. And something major has happened to them, something very traumatic has happened to them. Right. So how can you guys jump in and help them? Like what is your reintegration plan?
Right, so it's multiple steps. So first we want to make sure that we are addressing all of the risk factors that cause the stroke in the first place, identifying the cause of stroke so that we can prevent another one, but then identifying their specific needs as far as recovery goes. So sometimes it's physical disability, sometimes it's visual impairment, sometimes they're having cognitive or memory issues, sometimes they're having problems with mood, depression, anxiety. So addressing whatever their specific needs are, identifying them and helping to address them as well.
What are some of the risk factors after a stroke of having another stroke?
Sure. So it's similar risk factors to having the stroke in the first place.
Okay.
So high blood pressure is a really big one that we focus a lot on. It's one of the most common risk factors for stroke and one of the factors that predicts another stroke. So often for people who've had a stroke, the blood pressure is uncontrolled. For about 50% of people who've had a stroke, they remain with uncontrolled blood pressure even after the stroke. So blood pressure is a big one. Diabetes is another one. High cholesterol is another one. Atrial fibrillation, which is a normal heart rhythm that sometimes we don't detect until they've had a stroke, is another one that is important for us to address.
Can we talk about blood pressure for a minute? Because it's the silent killer.
Right.
And so many people don't really know, well, they don't know if they have high blood pressure. I don't think a lot of people know how to properly take their blood pressure at home. How often should you take it? Should you take it morning, evening? Like, what are we doing here?
Right. So it's very important to assess the numbers. So often it starts with a physician, but I really encourage my patients to have their own blood pressure monitor and to be monitoring their blood pressure at home to make sure it's staying within the range. For patients who had controlled blood pressure, usually once a day is okay. I tell them to check it around the same time in the morning. But when we're really trying to control the blood pressure, adjust the meds, I ask them to take it twice a day. So once in the morning, once at night, because blood pressure can fluctuate over the course of the day.
And a lot of times when we're talking about stroke, we talk about, you know, if you think you're having a stroke, to remember that acronym FAST, right? Face, arm, speech, time. What is the importance of knowing that? Because I guess, how often are you seeing patients who didn't realize they were having a stroke?
So unfortunately, it's very often that we see people out of the window for treatment for stroke. So they're coming to the hospital too late, past the window where we can actually treat them. So, you know, more than 80% of the time, people are not eligible for the treatments that we have available that really help with recovery. So we are getting better in terms of treating people with the clot busting medication, and you know, we have another therapy now as well where we can actually go into the blood vessel and pull the clot out if it's a stroke that's caused by a clot. So really knowing those signs and symptoms, FAST. There's even another acronym, BFAST, that adds balance and problems with the eyes to it. So really knowing that and then calling 911 right away. So time is really an essential component.
And then for our Spanish speakers in the community, there's Rapido, which is a new acronym. It's a much longer, harder to remember one, but for, you know, it's just the general idea, same concept to remember all of those symptoms.
Absolutely.
Yeah, because you've got a window of time, what, 2 to 6 hours to get one of those clot busting medications?
So most people are eligible within the first 4.5 hours, but we still say time is brain. So the faster you get treated, the more brain cells you're saving for that clot busting medication. And there's another treatment that people can be treated for up to 24 hours. We can go in and pull the clot out, but still we don't want to wait. So get to the hospital as fast as you can so you can get the best treatments as quickly as possible.
Yeah, and then coming up at 8, I'm going to be sitting down with a patient of yours, Tony Alexander, who survived 3 strokes. You were heavily involved with his treatment. Is there anything that you'd like to share about his treatment before we talk to him?
Sure. So he'll talk about it, had less traditional risk factors. So there are some of the traditional risk factors that we mentioned. And then there are other risk factors like autoimmune conditions that can increase the risk of stroke, clotting disorders that can increase the risk of stroke. Pregnancy is another one where there's some increased risk of stroke toward the end of pregnancy and after pregnancy. So there are, the common risk factors, and then there are the less common risk factors, less common conditions that are important to know about as well.
Wow. Well, I'm really impressed with your STEP program, and I'm really happy that you guys have something like that. Like I mentioned so many times, after a terrible diagnosis, people are left totally isolated. So thank you for doing that.
Thank you so much for having me.